Dr. Katy Kamkar is a clinical psychologist with the Work, Stress, and Health program with the Center for Addiction and Mental Health. She has wide experience counseling people dealing with trauma, and she is joining us tonight from Toronto. Doctor, thank you for being with us.
Good afternoon. Thank you.
So this is upsetting news. It's disappointing news. Can you talk to us about how the people involved in this story, the police, her parents, the family, extended family, are likely feeling at this time?
Indeed, Marcia, this is a very traumatic incident affecting the parents, the family members, but also the entire community, including adults and the children. Common responses to trauma usually include having upsetting thoughts in relation to the trauma, having nightmares, or a sense of relieving the trauma. People also might tend to avoid any reminders of the trauma, such as talking about the incident or thoughts or feelings, or might avoid any specific activities that can remind them of the trauma. Other typical symptoms include difficulty sleeping, concentrating, feeling especially irritable, and also showing signs of hypervigilance. So, for instance, people might constantly watch around their surroundings and out of the concern for their safety, and also might avoid activities that otherwise they might have engaged in prior to the accident.
And how do children cope with this compared to adults? And I just want to bring up something that's crossing our wires right now. It's being reported that Tori's 11-year-old brother has said, "I don't get to see her anymore." He's asked his father that question. So how do you deal with this news when you're a child?
Indeed, children, the typical, again, responses to trauma for children include also having a lot of anxieties and the worries and fears. Children might tend to become even more clingy to their parents and to their to their teachers. They might have difficulty as well sleeping, or with the appetite changes, and they might also show decrease in their school performances, and might even tend to withdraw from others, or might not necessarily want to go back to school.
Would you recommend that Tori's school have grief counselors on hand?
It's usually recommended to have counseling services. I think it's also important for the parents to really talk to the children with respect to any concerns that they might have. It could be about the worries or any anxieties they might have, and to really tell the children these are very normal responses to the trauma.
Well, sorry to cut you off, but I want to know a little bit more about this, because this story has made headlines, and it's almost impossible to keep children away from this news, to shield them from this. So how do they talk to their kids about it and not frighten them?
Yeah, so it's important to really talk to them, in a calm manner, and to indicate to the children that these are very normal responses to the trauma. It's also best to protect the children from re-exposing them to some of the reminders of the trauma, such as the news. For instance, also when adults want to have a conversation with one another with respect to the accident, it might be best not really to have the children there. Right. Also to help the children really maintain their family routines, including soothing activities such as reading books, listening to music, or walking. All of these things might be helpful for the children.
Dr. Katy Kamkar, thank you so much for being with us. Do appreciate your thoughts on this tonight.
Thank you.
Good night now.